Okay, on a kusha on a cabo, na me name Timu John Fuller. Yes, I'm particular about the T in the middle becoming up get the same name, so now I can continuously use the T for make sure say there's difference between the names. Today we'll deal with an overview of blindness. So now Dr. Rashid, Conteh and the present today, and as we see the whole well body Bεtεh Gentri team go there at hand for answer any of our questions. Dr. Rashid will do an introduction about himself and what they do and stuff like that when he gets to that stage. Okay, today at the 89th session, not 88th, 89th. I forget for change them. As good as I be, I'm not perfect. All right, like I said, we do blindness and overview, and today that's Sunday, the 25th of January, 2026. Now Dr. Rashid present. Said before me, na Timu John Fuller, and we get the well body Bεtεh Gentri team. We go there for answer any of our questions. Okay. Just a little bit about Twitter for that who not be done join with before. We in Sierra Leone, then we based in the diaspora. Some of with the America, some day in the UK now. We can within UK, we get people in Manchester, Birmingham, London, and we get another Dr. Bell with the Germany, and also we can get people and we can come on board for present. We can get doctors from Salon or other parts of the world. We can come on board for present no more. We usually make we do no for no they get paid. When they do a number for let we able to give back to we own people then because some of the things that we can affect to people and certain they we can cause either disability or maybe even sometimes lead to death or something that I think that we are avoidable. So this program here we come up with them for we be able sensitize people and give people them the knowledge where they need. And so tell you back when you go meet your doctor, you find that you get the knowledge for knowing when for go meet your doctor and when you go meet your doctor, this kind of question for ask. Okay. Now, me when they talk to now, me know to a medic. I don't get no medical background. Yes, I do medicine for waiting for 1 or 2 years, but I don't class myself close to even being a nurse. Me a business IT consultant. I focus on cybersecurity. I just then also for make sure see them book my house, we book presents to now. Make sure see the session them uninterrupted. So like I say, we don't get paid and we do we program in Krio for make sure see we will benefit with people them. So let's say where people go meet doctors because I be speaking English. But it better let them hear me in Krio so then go able to ask the right question when they go be doctors. Do you have me fumble them? Wait till they give now so not to personalized advice. Now general advice we they give on waiting for waiting the consult in illnesses, when for go see doctor and where go see doctor, waiting for ask and how for manage some of their issues their way we can end up get. Okay. Like I say before, the recording go there on YouTube and Facebook, and it might extend it to other social media handles. So, I know CS when I get to a data subject right when I can ask for all my information get deleted. But in real case, you will find it very difficult to able to do that. So they ask it, if you didn't have environment, we're not good for public view, you don't want your name for show, or you don't want your face for show, they turn the camera or for change your name, or you can stay on and listen. Okay. If you ask question and get 3 dots now, most of you they watch by with phone or iPad and stuff like that. If you look at this corner, you get 3 dots. If you click on that 3 dots, this page will appear. You can go here and chat to it, send me questions like I do on WhatsApp, or like I can do on Facebook. Or if you're brave enough and your environment's good enough for the ask question, you can press here so for raise your hand and ask you a question. If I not come to you quick, it not mean say I ignore you. Maybe I just not see you hand up. But once I see you hand up, I will make sure say I come to you. If you not sabi do all of that, you can turn the camera on and ace your hand up. I will see you, then I will come to you for let you ask a question. The panel where we get the diverse, so it go ask for let you ask a question where somebody no go down the panel for answer that question. However, if a personal question where they feel say they need for take them offline, then we will try for take them offline. Let you go ask them separately because we don't want to give the wrong advice. Not to say we not want to give personalized advice. And because we not get to a medical history or a medical background for them to make a judgment, we'll be able to give the best advice. So if I get any suggestion, feedback, questions, or even when I just want to pay compliments, I will email this, our WhatsApp number this, and plenty thank you for joining today. I can hand it over to Dr. Rashid Conteh. We're going to take on through the session today. Thank you. Dr. Rashid, over to you, sir.
Thank you. I'll just share my slide. Okay. Family down, good evening. I'm Dr. Rashid Conteh. Today, we'll talk about blind eye. inside this talk today, we go make an introduction, but before we go deep into the talk, I want make we familiarize ourselves with what we don't sabi perhaps, for just warm up with 4 short questions. We ready? Here we go. Number 1. How much tell with a blink per day? A, 80 to 100,000. B, 20 to 30,000. C, 10 to 15,000. Which one? 10 seconds. 8, 9, 10. Okay. Next question. We will answer the all if at the end of the 4th question. Number 2. Wetin make the iris scans the more guarantee pass the fingerprint there? In other words, why iris scans the more superior to fingerprints? A, because iris then get more than 250 unique features, whereas the fingerprint then just get 40. B, because fingerprints then can be easily destroyed or distorted by injuries, pass the iris them. C, because iris they're more protected than the exposed fingerprints. Which one?
Dear me family, I don't enable enough for able unmute. I've asked, I've been able to unmute people. So if you want to answer, you can unmute yourself and answer that. If your background or noisy, you can unmute yourself and answer the questions, please. But after this, I will mute everybody again. Thank you.
Number 3, I will say C.
Before you go ahead,
yes, sir.
Please go on to the slide mode. Just that you will be talking about. Just go on to that. That button there on top and yes. Just press on no more. That's it.
Okay. That's better.
There you go.
Okay. Back to the questions there. Number 1, how much tell with a blink per day? A, 80 to 100,000. B, 20 to 30,000. C, 10 to 15,000.
Wait, I think everything will make it easy now for let people raise their hand without one answer.
Okay, 10 seconds.
In fact, people they put the letter them, so that's good. You see, I'm not the chat.
Another you will
So
see
that's
that.
another way for answer. Would I brave enough for answer loud? Then by all means, do them. But it's very interesting for find out.
Okay, number 2. What to make the iris the more guarantee pass the fingerprint them? A, the iris then get over 250 unique features, where the fingerprint then just get 40. B, the fingerprints them then can easily be damaged because they're exposed past the iris. C, the iris, they're more protected than the exposed fingerprints. Number 3, left with the item, all man they turnable. If they work as if they work out with your head, what to make the item they do so? Why then the turnable picture them? A, the item can look at things from bottom to top, or because the eye in cornea is curve, so where light they enter the eye, the light they bend. C, because the eye they mostly can look things from top to bottom. This one. Okay, the last one. Almost different color the way we are able to see at any one point. Almost color, different color the way we are able to detect. Well, if you answer B on question 1, that is the right one. Question 2, if you answer A, that's the right one. Question 3, B. And lastly, D. But am I able to detect 10 million different colors? All right. So vision, or for C, now one of the most important 5 senses the way Motaman gets. They play a very important and crucial role now with day-to-day life. If you're not able to see, then you get difficulty for learn, for work, for play, for do anything in life. So what's in our blindness? Blindness, now where we not able to see things them or light at all. According to WHO, worldwide, about 2.2 billion people them get difficulty for see or they not they see at all. The causes there for this difficulty for see or blind eye, one of them na glaucoma, diabetes, now other one, cataract, refractive errors, age-related macular degeneration. Otherwise, I will talk about them a little bit more later. Inside salon, if you count 100 people, over 20 of them 100 people then they get difficulty for see or blind eye problems. And this they create big corporate business and social burden. If we look at the eye itself, where they look at person, the front view, the eye will look like the left image. The big black middle spot, we call them pupil. The light blue way surround that blue spot there, we call an iris. Now, if you come to the right-hand side picture, where then cut middle, and they see them laterally, after the pupil, they reach the lens, the eye in lens. After the lens, you get that big space where full with blood rope them. Then at the back of the eye, you get the retina, where then that light yellow color. Well, near there, you get the optic nerve, where they pass information from the eye to the brain, the visual cortex. If we look at this other image of the eye, which I don't talk so, front, you get a clear curve image when at the cornea. Then when you pass the cornea, you come to the anterior chamber, you come to the iris. Remember what I've been saying at the iris, they allow light for pass to the pupil. You pass the pupil, you go to the lens. Then from the lens now to the back of the eye, you get that big space where filled with vitreous humor. At the back of the eye, you get the retina, then the macula. Then you get the optic nerve. Okay, now so light they travel through the eye. Lights from the outside, they pass through the cornea, go right to the back at the retina. The retina filled with millions of cells when are cones and rods. They play different roles for make we see better. Where the lights they enter the cornea, go to the lens, the lights they bend. As I will say earlier, now because of that, the eye they tunnable images them. So how would they see how this vision they work? Well, as una don't see from the past picture, the lights they enter through the cornea. Where the lights enter the cornea they bend the light and focus them. After that, they come to the pupil, and from the iris, now in they control how much light for enter the pupil. Now where the light pass there, they go to the lens. The lens, in they focus more the lights where don't come to for make we able to see a very sharp, clear image. Now where you pass the lens, that light, they go right to the retina. Like now the negative, if they talk about camera. So inside there, now they, and the retina, now they, the image or the light they register. Well, that light signal, the optic nerve, they take them, then turn on to electric impulse or signals, send and go to the brain. The brain, they process them and flip the image to the correct position and interpret them. Now, so we they see. So what are this global vision impairments? What are the key facts there? As I've been saying earlier, worldwide, now about 2.2 billion people will get blind eye or eye problem or difficulty for see. But the good news is about half of them people their eye problem can be preventable if we do the right thing at the right time. Anybody can get eye problem. Anybody can get blind eye. No more. Now people that way old up to 50 years plus, now they more can get blind eye. Majority of the problem there, now old people there, like I don't say, way old over 50 years, now they can get them problem then. Now, if we count 100 people, 36 out of them 100 people now they don't get help from either near sight problems or far sight problems or vision impairment problems then. Again, if we count 100 people, now 17 people no more, now they don't receive help for cataract problems then. When again we put all together the numbers here worldwide, we see say about 2.6 billion people get myopia or near sight problems. 312 million people when are under 19 years old, young people, then get blind eye problem, whether near-sightedness or far-sighted or blind eye. 1.8 billion people get presbyopia, that is the eye lens don't slack small, not able to focus again for making them see better. Again, 76 million people worldwide get glaucoma. When you put all them figures here, they don't create a big financial burden of an estimated $411. That are plenty money. Now, Salon then do a study inside 2021, where they call RAB 2021. Now, rapid assessment of avoidable blindness. Inside this study, then focus on people that were all 50 years and above. Then take a total number of people, about 2,552. This study tell we side blind eye problem then mostly then at the country, how the blind eye problems scatter in the country. It also tell we what they cause this vision impairment or blind eye problems in the country. But he also tell we side the cataract service day, how people then can able access our side for get that service day. He also tell me about other disabilities then prevalence in the country, how other disabilities then they around the country. Then of course the economic and social problems that way this disability and blind eye problems they cause now the population. And how for understand we eye health problems then. This night table we just show you the figures there way they examined during the study, this 2021 study. They examine more women then, like 1,413 versus man there way now 1,085. Where then total all it come up to about 2,650. Inside this study, they also try for separate the population into rich people there, very rich people, poor and very poor people there. Then find out, say, about 31% of the richest people there now then participate in this study. Unfortunately, the one they way for participate more when are poor people there, now only 11% able participate in this study. We then look at the one whole country and the people that way then study this 2,552. Then find out, say, inside the Northwestern province, now they the highest number there. That is, if you count 100 people, over 9 people then get blind eye problem. The area where get the smallest blind eye people then, now the western area around them, if you count 100 people, now just over 2 people there. Let us say 3, now then get blind eye problem. Again, at the Northern province, now over 7 people there out of every 100 get blind eye problem. The Eastern province, over 4 people there, let us say 5 out of every 100 get blind eye problem there, and the Southern 4.4. Where inside this study, they also try for see what's in the cause of this blindness in the country in Sierra Leone. Then find out, say, untreated cataract, now in the number 1 cause, now in the highest about 85%, followed by glaucoma, and then other corneal problems them or diseases them. Then other posterior segment problems them. They also find out, say, complications where can come after eye operation for correct cataract, then they self can cause blind eye. Then obviously refractive error problems them. They self now other cause than the smallest pan this study where they find out 9 thesis where the eyeball they just shrink, they just get smaller and smaller and smaller. So much so that you not go able to see. Okay, so what's in this blindness now? Blindness, as we don't see from the earlier picture them, now a very complex process and not to one side no more it happen. So light they be reflected by the lens, by the cornea, and that conversion they happen, and then the picture they go register na the retina, and then the optic nerve take that information, they carry and go na the brain for let the brain interpret them and turn them the right way for showing the good picture where we supposed to see. Good and clear picture. So what's in a blindness? As I say, blindness, now where you know they able to see things around you or you know they see light at all. Where then they define this ability for see or the visual acuity. Then they give 2 numbers. The first number normally can small past the second number. But this is simply means say, if you get blind eye problem for this 3/60, which person when get normal eye map na a distance of 60 meters or 60 feet, they see clearly, you will get blind eye problem. You go for to map 3 feet or 3 meters for make you see clearly. That means say you eye get problem or you get blind eye problem. And this can range from partial to total light loss. It means either half enough, you know, they see or, you know, they see completely. And obviously that they put serious challenges, serious problems there with day-to-day activities. And with life quality, they also be impacted. This picture just they show we the normal eye against the blind eye. On the left, you see eye way normal. This one on the right, now eye way blind. Same way, so this eye no they see fine. This almost normal. That were normal, this no they see. So like I've been said before, the normal person where they see normally, then describe this visual acuity with numbers then. Inside America, then they use 20/20. But here in the UK, they use 6/6. 20/20 just means say, if you team up 20 feet or 20 meters from the objects where they look at, they see clearly from a distance of 20. So 20/20, that means 100% visual acuity. But again, if you see the last figure, 20/200, it just means normally where they see an object from 200 meters, you will get blind eye, you get for to map 20 meters from that object before you're able to see clearly. So what are the types of blindness? Well, we get half and half blindness, we got complete blindness, or blindness where you're born with, or you get blind eye, sometimes you sick way and boggy eye, and where you well, you don't get blind eye. Like I'll be explained, 20/200, that means you really get blind eye problem. Waiting at the other classifications then. Well, we get social blindness, where you get a visual acuity of 3/60, where means for person where they see clearly at 20 meters, you get for day 3 meters from the objects for make you see clearly. Then we also get even one way was passed down the when I manifest blindness. This one, you get for day 1 meter away from the object for make you see clearly than the normal eye where can they up to 60 meters where they able to see clearly. Then the worst and the all now the complete blindness. This one, they see nothing at all. They see light, they see anything. But we also get color blindness. And now 3 main types then they. The first, they able to recognize red. Well, if you look at them picture, yeah, this is not the normal one. That means they able to distinguish all the colors there. But yeah, they able to recognize red color. Yeah, they able to recognize green color. So yeah, this now protanopia, where they able to recognize red. This one now deuteranopia. But yeah, they able recognize or distinguish between blue and yellow color. This one now tritanopia. Now the kind color blindness then they want. So what's are the etiology or what's are the causes of blind eye? What did they cause this blind eye? If we look at this list from top to bottom, top now the most common cause, whereas as you go down the list, you get less common cause there. But the number one on this list now cataract, then uncorrected refractive error. Depending on the shape of the eyeball, the shape of the lens, now it can cause these refractive errors. Then you get glaucoma. Then you get bacterial infection there, like trachoma, or corneal diseases there, where they make the lens, they become cloudy or opacity. But we also get vitamin A deficiency or nutritional deficiencies, we then call xerophthalmia. We also get age-related macular degeneration or diabetic retinopathy. Self-nas alone, at some point, we can get onchocerciasis, that river blindness, where they cause that black fly, na the water side there, where they cause this river blindness. But we also get measles, some viruses, or retinal detachment, or the least one, trauma, and others there. All they cause blind eye. If we look at this picture, now Africa, we get cataract, as I don't try for describe earlier. This cloudiness na the eye, they make the eye not they see at all. The lens not they able to see. So then two picture here, na cataract. This one na bacterial infection, especially trachoma infections. Na in they cause this kind picture where una they see also. Yeah, na corneal diseases them. It can be say na hereditary disease. It can also be infection, or it can be trauma where they cause them kind corneal diseases. Then. If you can, this na glaucoma. If you look at these two pictures, this na the normal healthy eye. The pressure normal now, because the eye get the openings there intact inside the extra fluid they drain, but yeah, the side there outside the fluid they drain, they don't block. And so the pressure inside the eye don't increase. Because of that, it is suppress or it press by the optic nerve where they carry the information to the brain for interpret what you supposed to see. Now down there, they cause blind eye. Yeah, now nutritional deficiencies like vitamin A, also they cause blind eye. But if you look at the next picture, this now problem of river blindness, where now that black fly na the water side and the cause, we then call onco. This one, the last one, na measles, where you get measles, where severe, it cause blind eye because it unblock the cornea and the lens. Inside Asia, same thing. The first two picture there, na cataract. Yeah, na bacteria infection, the trachoma infection. Same thing here, the glaucoma. Too much pressure inside, like the second picture now. Yeah, nutritional deficiencies, and then the corneal diseases there. Now Latin America then gets overall fewer causes. Then get cataract, then two pictures here, then get glaucoma again, too much pressure inside the eye. But they also get diabetic retinopathy. If you look inside, then two eye them. This is not the normal one. This is not the eye where I'm born with diabetic retinopathy. What can happen is the blood can be difficult for travel inside then small blood rope there. Now the eye of person will get diabetes. So much so that sometimes the small blood rope then can burst. And where then they burst the blood they scatter inside that space the way they cause blind eye. What are the causes then now alone? Well, as I don't say, cataract also now one of the major causes then as alone, like we can see in the statistics. Followed by glaucoma. Glaucoma very aggressive and it need early diagnosis. You also get corneal scarring, which can be due to trauma or infection or maybe other diseases there. But we also get unaddressed refractive errors there, where they like the light not they bend whose eye is supposed for bend, or the focus whose eye is supposed for focus because of the shape of the eyeball, the lens, etc. So all that they cause blind eye na alone. But other contributing factors where they cause blindness na alone include poverty, the poorness between people there, especially upline and the villages them. They not get access, they're not able to reach whose eye hospital day or whose eye doctor day for make them go help them. Also, overall, the health system is weak, is not too well established na alone, and therefore enough centers they're not there for let people then go get help. If then they serve people then poor, they're not able to get the help where they need. But also we get geographical barriers. This, as I say, now the remote areas, the villages there, people they not get the knowledge, they not get the know-how, then they don't know who's I for go and help. We make this kind of program where we they make so very useful for make people then know what for do, whosoever then they, if then they listen to it, for go get help when they get problem. As I've been saying, uncle now also other problem na salon where they cause blind eye. Waiting at the cause per picking them. Well, cataract also there, number one, but we get nutritional deficiency like vitamin A. We also get refractive errors them or retinopathy of prematurity. This not just problem where abnormal blood vessels then they grow na the eye where they cause this blind eye. The cause then third world countries like Salon, cornea scarring, maybe due to measles or cataract again, or nutritional deficiencies, or what you then call ophthalmia neonatorium. This na other way for say blind eye where baby then they get like if their mommy gets infection from gonorrhea when a sexually transmitted disease. As the pikin they pass now the back canal, they touch that infection there and they make they get conjunctivitis where pussy when this problem. What are the signs and symptoms of vision loss? Well, where you get blind eye or they see half enough, then they see clearly. The picture where you can see it blurry or just cloudy, they see clearly. Your eye then can be so sensitive to bright light. You can see like rainbow or like a double ring now objects, they see clearly. Then your central vision self, they clear at all, like what you they get in macular degeneration. Where you get that kind of problem, then you need for seek help immediately. When nets they come, then your vision don't reduce, they see better again. Then you side vision or what you call peripheral vision, inself, they fine again, better. You can lose vision completely, where they able to see the peripheral vision. The day-to-day challenges with this blind eye symptoms or signs, we can see what you call floaters. Think that way just shiny like star them before you, or then just they flash, they swing around in the air. That they make you difficult for even watch TV or for make you recognize people them face. You're not able to see well. It can make you fall down easily because you're not able to see clearly. You're not able distinguish color then, like green, red, etc. How would they diagnose them problem here? Well, like any other disease, we need, first of all, a good medical history We need from the patient how they feel, what we call symptoms. We take all the jottings then down, then know what are the problem, what will be the likely problem. After we don't take the history, then we will proceed for examine the eye. We examine the visual acuity, like I've been mentioned, then number then day. Which person they able to start, how far they able to map for see things clearly. Then also we can use with devices then for open the eye and see through for know which side the problem there. We can also do imaging for try find out which side the problem really there. We can do what you call tonometry, where they try for tell we waiting at the pressure inside the eye, how high the pressure there, or whether it low or normal inside the eye. Self, we can do what we call optical coherence tomography. This now other imaging technique where they help we for make we know which side the problem then at the eye. Not so painful or invasive procedure, but very helpful for diagnose some of the problems there. Self, we can take images of the cornea, that curved front organ at the eye where light the first meet. But after all that, we can even refer the patient to eye specialist for further evaluation, then for treatment. The key things that we for take away from early detection is very important for make them treat you for make go worse, so that the outcome will be good. That means when you begin feel abnormal, you need for find which I help there for let them go help you. More diagnosis for particular problems than like cataract, as I've been saying earlier, mostly we not can get early symptoms. And cataract can normally happen as we the age, as we they grow old. The lens, they become cloudy, they become they clear, so we're not able to see clearly. They see like cloudy vision or image, not clear at all. So for diagnose this, you get for open the eye and then shine light through and for see through the eye and know whether the lens of the eye or the cornea now you get problem. Obviously, the treatment for that now operation. Then get for pull the side way down cloudy, put artificial lens there if not the lens, then the problem will be solved. Same way so with glaucoma, when at the high pressure inside the eye, we know they get early symptoms. And this way, it don't advance more the peripheral vision, also the loss, they able to see things them around or on the side. Then we need for examine the eye, open the eye, shine light, and measure also, try for measure the pressure inside the eye for know if it high or it normal. Then the way for treat this now really medicines, I drop them where they able lower the pressure, or self then can use laser treatment. If you don't bad too much, then can do surgery operation. But the way forward now for really get regular checkups or eat healthy diet. Other one what I mentioned earlier now diabetic retinopathy. In self not can get early symptoms. As I've been saying earlier, this they make blood difficult for travel around and small blood rope then. So sometimes then rope then can burst and blood spill over inside the vitreous humor. Now down there they cause blindness. So For diagnose then they as soon as they see on this picture, then they use this device when a slit lamp for see through the eye and see if not the diabetes they cause this problem. For treatment injections, or then can use laser treatment or operation. What's are the general treatment for blind eye? Well, it can be medical, it can be operation or self. It can be then rehabilitative centers there for eye problems. Or sometimes some blind eye, we can able to prevent them, like I've been saying earlier. If we go seek help quick, then can able prevent them completely. But some form then just permanent. Once you don't blind, you're not able to see again. Like the problem the way glaucoma they cause. Well, common treatment there for specific conditions then like cataract, even via operation. Now operation then they make for clear the cloudiness or change the lens way don't unbug, put artificial one. In the case of glaucoma, now eye drop there or laser therapy or surgery. But if now infection or nutritional deficiencies, then the way for treatment now antibiotics for clear the infection and then vitamin A supplements or the vitamins where you lack, then supplement them. If now diabetic retinopathy or age-related macular degeneration, then we get what they call anti-VEGF or anti-vascular endothelial growth factor. This is a protein where they encourage the growth of abnormal blood vessels. So then get this injection where medicine where they stop this protein. And so if then they give this injection, that will help with the diabetic retinopathy or laser treatment. Other new treatments then they come up where look promising, like this low-cost gel injection. This they kind of normalize the pressure where they can use in case of glaucoma. But you also get gene therapy. Then you get stem cell technology where then they use for implants, or then can use retinal implants also where they call bionic eyes. Then they help for treat some of the problems then. Then still they research some of them, but then look promising. How would they able to prevent cataract? Well, for protect we hide them from the sun. For able use sunglasses for protect UV rays where they cause cataract in the long run. We for also able to protect we eye there from injury or trauma. Then we for left for smoke. Smoke, they also cause cataract or blind eye. Nutrition and habits. As I don't say, we for left for smoke. Then we for eat healthy foods then, like fruits, vegetables, green leaves and nuts and whole grains. We for also get regular eye exams then, for examine we eye them. So the key now for eat healthy, like vitamins, where they support the lens health, and then where they slow the cataract formation. What in our WHO then recommendations? Well, WHO say we for prevent we blind the eye through lifestyle. Lifestyle that can mean say what would they eat or how would they do things then from day to day. We for left for smoke, we for eat healthy food. What about the environment and the healthcare? Well, we for also get regular checkups for check we eye them. We for encourage picking them for do outdoor activities, because if picking them day indoors all the time, this they encourage myopia, that is nearsightedness. Whereas if then they outdoor, that will help them for they look far for balance the short-sightedness where then they inside enclosed places rather than outside. That will also protect we either from ultraviolet rays where they unbog the eye. The public health initiatives, this also they help for check we eye in healthy one. We for able address we nutritional deficiencies, like if we get vitamin A deficiency, we for eat the food that way rich in vitamin A, because down there if we lack itself will cause blind eye. If we get systemic sickness then, like diabetes or hypertension, then they also we need for control them, because if we not control them, it can lead to blind eye. Waiting are the main takeaway points then. Number one, we for eat healthy food. Eat fruits, vegetables, nuts, whole grains. Left for smoke. Get regular checkup. Maintain healthy lifestyle habits. How will they manage this if we get other sickness then? Well, like I said before, if we get diabetes, we get hypertension or infection then, we for treat them with proper medication, because some of them, if we not treat them, then can lead to blind eye. If we not get sufficient nutrition or we food lack some vitamins, then we for address that. We for protect we eye them from the direct sun or from the ultraviolet sun rays, because then they self can cause blindness. We for protect we eye them from trauma or from injury. Some references. Una thank you.
Thank you very, very much. Yeah, thank you very much, Dr. Rashid. I've been there. A small noise been in the background. I'll be trying to get it off. If I'm going to plenty, thank you. All I don't see them and listen. Now the baton don't pass to now for ask any question. Like I said before, if you ask question, you can either use your device for do them digitally, or you can ask you not physically if I see you, I'll come to you. For take any question. Okay. Monica, last.
Tim,
yes.
Sorry, before you go to that.
Yes, sir.
Ask Doctor make it stop for share, please.
Yeah, I go. Yeah, perfect.
That's it.
Okay.
Brilliant.
Okay. Right. Anyway, okay, yes, Mr. Dabo, I'll take you.
You say Chief Dabo, now you say Mr. Dabo.
Level.
Okay.
Yes, Chief Dabo, how are you, sir?
So,
welcome, sir.
Thank you, Dr. Conteh, and thank you, Fala, Mr. Fala. You do very well.
Obviously, you want to say Dr. Fuller. Yeah, obviously, I'm promoting.
Dr. Fuller, sorry. Now, Dr. Bay. Now, this is so good, man, because me, as you can see, I use glasses, and a diabetic as well. But my sister, I get my sister way not almost blind at all, way down the one of me bad one. I think he talk about Uncle Sakiasis. Now, Salon, if she don't do that, they don't do, not did it again, or what thing?
I think it don't reduce significantly, because I understand some years back, WHO being make some program where they may go and spray around the rivers. So that being kind of eradicate most of them black fly and the way they carry this parasites where they cause this worm where they cause river blindness. But for say the honest truth, I don't know specifically if it done completely. Near me village, we get river there where I know very well say them black fly them been there. But it don't taste more since I go there. Before
Them
you
black fly,
prepare.
then I don't call them mutmut, not a mutmut, then call them.
It could be. I'm not too sure of the name per Krio or Salon, but a black small fly.
Yeah, I wish we were able to get them fly then they like the photo so that people then would know. But anyway, that are the first question. Then he talk about pressure at the eye.
Yeah.
And it appear like say he say watana they come, watana the common at the eye or something. What do you mean? Now the tears, they get the tear, they get watana in the eye, watana they calm down if you cry safe.
No, not necessarily the tears. The eye through the iris, they produce fluid where they replenish because you get for replace the old. So the old for drain now sat inside them. What it can happen, this now glaucoma now, what it can happen is then drainage side then can block gradually. And if they block, that means the drainage not the flow good or the fluid not able to drain. And if the fluid keep accumulating or the drainage slow down, then that accumulation of the fluid and they cause the pressure. Now, as the pressure grows high, it press down on the optic nerve. The optic nerve, now they take information from the retina, can go to the brain for interpret what is supposed to see. So now the basic problem down there with glaucoma, where the pressure they
So the water way they talk not to tear, not to water way now, yeah, water.
No.
Okay, now different water. Okay. The last one now, the diabetic retinography. When we get that the diabetic retinography something.
Mr. Dabo, I think
sir.
Dr. Kamara want to elaborate a little bit on you.
Oh, okay. So,
my brother, yes, thank you so much. The question very pertinent. You see, as we grow, so the eye itself the old. So you find that some man then they see themselves, when they get older, the sight they worsen. Yeah. So that chamber the way Dr. Conteh they talk about the front bit, the cornea, when that one way not get no color. The eye in color, now the iris, that's the way the inside there. Now it could be green, blue, brown, or whatever. Okay. So between them two things then get water there. Yeah. So the anterior chamber get water, and then you get the posterior chamber inside get water. Okay. So you get a pressure where supposed for day between 10 and 30. So man say extend that to 40. If you day beyond that particular level there, then what did they do? Like how you quiz egg in raw one. If you imagine say the raw egg they pancakes. Now you push the contents where you don't get no side for go. And that they make this eye begin swell inside to the point now where it begin touch the back of outside the nerve there, when then they give you the interpretation, and that they lead to blindness if they're not correct and quick, where then for allow for let the water begin drain. So the mortal man in the eye, he gets the canal naya inside here, where they call Schlem canal.
Yeah.
That Schlem canal there, anytime where you blink your eye, now wash your eye. So I don't know if you know that.
Yes.
So anytime we blink, now wash your eye. Imagine say that thing they don't show shallow, that was where they wash the eye, the water or whatever it is they put in the eye, they go out again. Now make anytime where you cry, the nose self they cry. Because the water they pass through that all day go under the nose. You see what I mean?
Yeah.
So imagine say that place they don't block now or it don't narrow. Therefore, it need to flow like for flow. And that night they create this pressure waking glaucoma. If they not check the eye pressure, then it can cause problems because by the time you appear at the specialist center, so until you don't become blind. I hope so that's clear.
Very clear. Thank you, sir.
Thank you.
Thank you, Dr. Conteh. Okay, the last one before you go. Sorry, guys. This one, this eye, they bug me eye. This diabetic thing where you talk about the retinal something. I don't remember the scientific name for it.
Retinopathy, yeah.
Yes. Now, the nerve stem where you say the boss, now only inside the eye the small capillaries of the nerve cell, whatever it is, where the cause the blindness. Now inside the back of the eye or inside the eye itself. How can you prevent that?
If you look at the eye picture or image what I've been shown, between the lens and the retina where they at the back of the eye, there's a big space. Inside that big space there, plenty blood rope them or blood vessels, small one then they. Now in diabetes, it's difficult for let blood flow through the small rope them. So what it can happen, the other picture will be better. But anyway, this is still okay.
This one?
Yeah, that's it.
Yeah. So what it happen in diabetes, there's small blood rope there, because the blood difficult for make it flow smoothly, then they burst, and they burst, then this they cause blind eye. I think that's the simplest way I can able to explain now.
Okay. Thank you, sir. Thank you very much. I appreciate
this.
this.
So for add to that,
yeah,
I don't want to take Dr. Conteh. You see that part the way this is on the back. Usai that thing come out like yellow. Yeah.
Yes.
Usai the retina day na inside. If you see that's it. That yellow thing day na the retina. The retina na day the tunnel image they go pass. For let interpret and pass the nerve go na the brain and give the correct image.
Yeah.
Because the diabetes they affect the vein and the artery them.
Yeah.
That particular thing that we see attached to that area, they can come apart.
Yeah.
When it come apart, now there you go begin see floaters, halos, shadows. Okay? It can happen because now that diabetes they do. It involve the veins and the arteries, now the foot, now the kidney, now the heart, then the eye. Okay? So when you affect the eye, now then called retinal detachment. So man, when somebody read that, then they're afraid. And indeed you need to be afraid. Because nothing when they go back again to normal. It can get better if you control the diabetes better. I want you to be clear. Yeah.
Yes, thank you, sir.
Diagnose them, that's it. Yeah. But it can get better, and you can install the blindness for a number of years if you actually manage the sick well. By so doing, the sugar, the eye, regular checkups, and all that in there.
Thank you. Thank you, sir. Thanks very much. Thank you, Doc. Thank you.
Thank you.
That's all. I'm done.
I don't miss this.
Thank you so much.
Any other question?
I just look here. There's question in the chat. Just give me 1 minute so I'll bring and come up. We can begin for me. Okay. The question is, what about the retinal detachment? And the person said they've been tell and say this they lead to blindness. I guess you don't cover them, Dr. Kamara. And now Monique, can I ask Danny? Danny, answer your question. If you answer your question, just put thumbs up on the chat, please. Because I think Danny cover within Dr. Kamara just explained just now. Okay. Right. I've been getting some questions they were asking, and also about the river blindness, the black fly. I don't try for look on Google, to be honest. It hard for let's see what's the difference between that fly and regular fly. So I guess maybe the doctors they maybe go find one way, maybe, or maybe Mr. go try for see. If they get one way show the distinct features then with that fly they get. I go try for look later on. I go post on at the forum. So the one at the forum go able to see them. But I don't put something at the chat. Wait for the life cycle of that river blindness and river blindness fly, the black fly. So you did at the chat. If somebody want to have a look at it, you can download them and have a look at them later. Okay. Questions they will be get. Hold on 1 minute. Okay. Now, the question I want this now for anybody within the panel, any of the doctors then within the panel. We understand say diabetes rates the rise in our community. When I say community, I mean salon. Which kind of advice when I would give the people them regarding when the issues that we relate to blindness and whether this is age related. Which kind of advice I would give? Say for example, people for they go do regular checkup of their eye, therefore do them at any age, or he associated with a certain age. Say for example, maybe when you don't turn 30 or when you don't turn 40, if you try for go get yourself checked up, one for any medical related stuff, for example, which one of them will be diabetes, and if you're diabetic, you will be advisable for let them do checks for the eye. So which one are your advice?
Dr. Conteh Wango?
Yeah, okay. Diabetes, I think we don't talk about power sessions then. At some point, if you follow healthy diet, it can really able reverse them. So the way forward with diabetes for let you go and bog the eye, now for take regular treatment, regular medication, and a healthy diet. If you do down there, in the long run, it's possible for reverse that condition there. And if you reverse them, then you don't solve the eye problem because diabetic retinopathy no go happen. So now alone, because diabetes don't so rampant, it's easy for spillover to blind eye problems until we able manage well the diabetes generally in the country. It will be difficult for we slow down the diabetic retinopathy when at the eye problem. But it just need a lifestyle change, lifestyle amendment. You will able manage well the diabetes. We go then stop the diabetic retinopathy.
Okay. Now, say for example, Dr. Kamal, they can't in a bit. Kimono as you and they up and Galaxy as well. They can't in a bit. Just be a 1 minute, please. What I try for ask as well. Now you talk about when the person don't get the diabetes, so you don't answer one side of the question wherein you advise the person for let do eye test as well for make sure say and also control the diet and stuff. But what about before that? Is it something that I get for just no say because not all know whether we grandpa and granddad will be blind before they die, whether it be linked to diabetes or maybe some of we things in a witch or a juju then do them, for example. So with that the advice say for let everybody do a random check or then check they also for diabetes. Is there a certain age where person for good try for get this check done? And when they go for get this check done, if they find out say they get diabetes, you go advise them say for them do the eye check in the same process as well?
Yeah, definitely. You don't answer part of the question now, your question. Regular checkup, eye checkup, now one of the points that way have been mentioned, where WHO recommends say we for do down there for we eye health. So if regardless whether you get diabetes or not, if they do regular eye checkup, then can able find out any other possible eye problem other than diabetes or diabetic retinopathy. But with problem na salon, most people, especially the one that way they upline at the villages, they don't even know. So if you don't know, say you don't know, then you not go do anything about it. And then before you wake up, it might be too late. So one of the recommendation is regular eye checkup. Although we get problem in geographical problem, that is the eye hospital there or the eye specialists there, they're not plenty in the country. And so the few side and they go be for some people there now upline. But all down there, it just come to understanding. If you know, say, I been hearing about this talk some side, and because I dey feel this way, I need for go find help. I think it can able make you way. So I think the key here is regular checkup, regular eye checkup. When you do
Okay.
that, then go pick up whatever problem is there, and then go able help you.
Okay, we get few people in the wait because I look back say regular eye checkup. We go look at the next part as well, which is the dependency, i.e., then center they're easily accessible for people in upline, but go look at that on another question. Just be a 1 minute. Kimono. Kimono.
Okay.
Yes, sir.
Yes, sir.
How are you, sir?
Hello,
Welcome
sorry. Good evening, everyone. Yeah, no,
Yes,
I'm
Chief. How are
just
you?
one.
Good to see you.
Yeah, thank you. I've been just want comment briefly on the to Honorable Kamodabo in question about the black fly. You know, in my early teen, I've been grow up in Najala, and the river where they go swim, they get black flies there. Two very important things there where they easily able distinguish black fly from any other fly. That one wouldn't call fufu. I think it's more like a fruit fly. It's in the genera fruit flies, but they have a slight sting. The fruit fly itself not get. The black fly, it get a very distinct sting. Where black fly bet you now like mosquito. The one problem with black flies is they're always in swarms, directly hovering over the surface of the water. If one bet you just know, say you're in for 100 bites. Yeah. The thing at that time, when they go swim or then they will water and have been problem, will be they dive. Because if you mistake come out na a sideway, a swarm day, then they bet you. Now, for CD black fly, it's very unique because it's about the size of it's about a third of the size of a regular house fly. That means the black fly, it not going to even take the thorax of a normal house fly. But then they always get them black and then get two silver circular or striped circles just behind the head and just before the abdomen. So if you see dark fly with a glance, normally like if sun they hit the water, then they shine. Okay.
Okay.
Yes. Now I've been just one help because myself check a picture on Google, you hardly able to distinguish the size.
Exactly.
Yes, but
exactly.
In general, the black fly is very small. Like I said, it's almost as about a third of the regular house fly. But then these two, the white markings, now then are the most important.
Distinct
and then,
markings.
Yeah,
Okay.
distinct markings. Okay, now that's normal. I mean, just one contribute.
Thank you. Thank you so much. Dr. Kamara, if you look at the question from Elabaya, that last word they mean, and I will let you give an answer. So we'll come to that in a bit. Auntie Monica? Thank you very much.
Don't put it down.
Yeah. I'll come to Galaxy. I'll go ask him still if
I think it's a doctor, na free tongue or something, because he wears scrubs.
Okay. Auntie Monica? Okay.
Yeah, sorry. Now just a new app I just put. Yeah, good evening. I was very, very happy when I see this program because I believe I suffer from my eye problem. Those of you within a year we know me and I know say it's been over 7 to 8 years why they suffer with me eye. Waiting then diagnosed and say retinal detachment, which it could possibly be the lupus where I get or the high blood pressure. I've had like 4 major surgery in the eye and then 2 cosmetic and then 1 laser. But up till now, I dey feel pressure, I dey feel the pull syndrome in my eye. When I wake up in the morning, the first 5 to 10 minutes, I need to able open my eye. It's always locked. And then after that, gradually it open. So when I see an eye doctor here, when we young Sierra Leone doctor we qualify for waiting I own advice to give to people like us. Then unfortunately, I don't add into it now when I'm a diabetic patient. So even make them worse for me. So waiting I own advice we go give to possibly they suffer from retinal detachment. It done several surgery, still not successful. The eye is very, very I don't know to say it. It just deformed my face anyway. For now, when you know me before, and now if you look me, even though I don't get so many cosmetic surgery on it, but it still need to work because for waking up morning at trouble and what I feel, the pain, the pressure, it's just ridiculous. Yeah. Waiting advice to me. Thank you.
Thank you so much, Auntie Monica, for your question. I don't know, Dr. Kamara or Dr. Ture, any of now pick this up or give Dr. Rashid a little bit of break?
Well, Mrs. Kamara, thank you so much. We're sorry for the problem the way you don't develop. Now, we can take this offline if you like, because we don't get without doing the talk.
I don't know, it's guy for see whether in back.
Yeah.
Oh, okay. Yeah, go on.
So what do they say here is this. I mean, we can give you a short answer and we can give you a long answer. But the short answer for me here is this. You don't talk about the possibility, say you get retinal detachment and you don't do surgery. And a few of them you don't do. And then, of course, the blood pressure itself don't become a problem. And, of course, when you wake up in the morning, you can get the NTI, they go on. And then, of course, to top that, diabetes don't come in. This is the thing we have been the try for add to waiting Dr. Rashid Conteh in the talk. Then 2 years, diabetes, blood pressure, and then pandemic picking them asthma, then call them non-communicable diseases, NCDs. Then they talk to you, but you know the yeri. Yeah? Because of the fact that some man, now the tempo you go actually know say na problem that way get, pass until you end up in hospital. Something with a stroke, something with a heart attack, something with the eye go blind or something. That's the kind of thing. Now make anybody with a diagnosed with NTI, they can definitely get regular checkups. So every 6 months, then go check the back of the eye, then go check the foot them for diabetes. You see, and of course, if that person did they smoke, then go check for see if they get this peripheral, vascular disease or peripheral neuropathy, as they can call it. All landing up for just for do the circulation of the limbs, as well as the ropropodin at the eye and the other organ them. So the combination where you get, Mrs. Kamara, not to team where we go say we advising that this one thing I'm for do. I think the best thing for you for do is the people that the specialist on this thing, whether the ophthalmologist them, like the people in way supposed for handle this. But you get a combination. If you're able to control the sugar better, you're able to control the blood pressure better, and then of course you then get regular assessments them of the eye, then they go obviously they in your benefit, you go there something will go be useful to you. Because then they keep an eye on things and they can see that here. And so every time when you get a problem where I come out from which you don't they see, it's not new thing, when they notice them, you better for let you pick the phone and talk to them. If they give you appointment date, you finally you attend them, make you note in the gone. If there's something new, talk to them because you get to get a direct line. But the lupus, the diabetes, the hypertension, now 3 things and then when they mix, they can always give you a high risk. They put you at a high risk for that thing they above the eye, as well as the kidney, and of course the heart, and then of course the limbs them. So we can take this offline, but as I say, the top and bottom of it is that the people who are specialists, them payai, with an ophthalmologist, them, not them best for handle this. But maybe you can talk if you want later. Thank you.
Yeah, I think say it go better because in last comment now that you don't lost trust in the system, basically.
Right.
I believe something must have gone wrong somewhere.
Yeah. Okay.
And maybe there's been a breakdown in trust in the relationship, which is very important when it comes to doctor-patient relationship. There has to be that
Absolutely.
trust. If that, and that's the reason why from few sessions I can always say doctors try to be open and honest with them patient, but also not treat people like for say people don't understand, because at the end of the day they go through their challenges there. I believe say they know self better than you, how then they feel. So I believe say it has to be in any diagnosis, that patient has to be, that patient-centered care where they promote at the moment. I think say it for be paramount, wherein you listen and within how the patient they feel, and also try and take some direction from within then they feel and within they tell you, then you can take your direction from there. But definitely I can take them offline.
We can take this offline, and then you talk about this big word within the chat group.
I didn't tell you. Right.
This is one of the ways they call the P is silent.
Yeah.
And the way you spell itself, there's a small typo than the E day after the T. So not pterygion, that's what they call them. Pterygion. In fact, I can get a picture what I sent to Dr. Conteh of that pterygium there. People the way they work na nature with like them farmers, they mostly they can get that in there. In fact, if you go to Dr. Conteh in presentation, the titular slide, if you go to them back, if you get possibility, I've been noticing this go come up. I don't know if you for present them or maybe the slide will show the man in face, we get the cataract na the right eye, the left eye na pterygium, and they get to.
I
think maybe John did one. No, the first one.
Yeah, no, also I've been there.
No, you go up. You go up to the titular. No, up. The first one, the titular one.
No, the first one in
No.
Yeah, that's
titular. Go up no more.
No, there's nothing there. Oh, the very first one.
That's it. There you go. That's it. I don't say. I'm not the tell you so. If you watch the right eye, you look at the cataract. You see, it cloud the one cornea and the pupil. You need to see yourself. Now, make the light need to go through to the eye where the person need to see at all. With the pterygium now, if you look at the inside there of the eye, like the inside naya.
This one or this?
No, the left one. You see, that's it. Now the one down there. You see that bit there we get that red mark?
This one.
No, the other side, the other eye.
This one.
That's it. That red mark there, you see how they join inside the cornea there. You see that round white and black bit there? Where you see the light. Yes. That's it. That's in there. We join that red mark there, we join them. We get blood vessel left. Now the pterygium there. So it's like where the sun they bond the eye, and I think say I such a Google for ask this question. Yeah? Because they ask you this question, say people with the kukri, the free tongue. It can bug the smoke, wouldn't they burn the wood? Now smoke they can bug, they can make they get problem with the item. Yeah? Now the stimulant like this. Now professional hazard, this one. People who they walk now farm them. People who they walk all of the time na sun, under the sun. Now I make Dr. Rashid talk and say, the WHO recommend say, make they use goggles. Make them use something for protect the eyes. Yeah? Because of the ultraviolet rays. And then can cause that in there. So it's like you get an inflammation when like, like a not an infection, but it react to the eye, the ultraviolet rays, then it begin mend. Where the mend itself now can make that in there they attach to. So Monday, it can so bad that it attached to the front of the eye, outside the pupil there, we go make the no see them. Then they see eye again. Then they see the nothing again. So therefore, they have to go do small operation. Then they peel that one, they come out. I don't know if I go to send that picture there to you, let you show them. If you able to show them. Then go peel that in the come out.
I will put it at the group. Yes.
But you not guarantee say when they don't do the operation, you not go come back. Okay. Are you with me? That's not the pterygium. That's what it is. Yeah.
Okay. There's another question as well from Mr. Dabo.
Yeah.
From Chief Dabo. Something to do. Hold on, I'll just go to Lano. Oh. Yeah, it say any comment on laser treatment to correct eye lens?
Oh yeah, that's what they do. Then they do most of the time. In fact, some people they now can get problem when they try for correct them. I tell you this because I know me that this when they do the laser treatment panel, work. You not necessarily say guarantee say you go work.
Exactly.
Yeah? So
they try
work for people that they work. So clearly, sometimes they get for do corrective surgery. I even get one my colleague who I work with now. They go do laser treatment. It go bad. They go for now do 3-4 surgery. The boy now they struggle for work as a doctor because of that. So these things happen, yeah. Then they make mistake, and sometimes they need to do for let you see 100% because within do errors do happen, or sometimes within they use know exactly within you require, and so you get for now recover. That's it. Can you see the television 9 Dande?
Yeah. So the other part is there's two sides to in question. It say sound like a scary procedure. So
You ordered the pill?
Yeah, the laser treatment.
No, then they numb the eye. It's scary in the fact that everybody when they touch your eye, clearly you go scared. A bit about that. You know what I mean? I know somebody will deny, he refuse himself for go do eye surgery because he feels say when they go touching your eye, you go get cross your eye. You know what I mean? Because of that, he say, oh my God, no, not to me and you. I need to go and die. For years, he denied himself that opportunity there. And by so doing, by the time they go for go do the surgery now, knowing that, it's not too late. So you know mean say because somebody in your surgery go wrong, it means you yourself you go wrong. Most of the time the people that they do are people that will get experience, the people that will get the training required to make them do them correctly and then get the best result from them. But when they do operation of the eye, obviously it's scary, like any other partner of the eye. But of course, because the sight, the sense of seeing or the sense of vision, that is most important about all the senses. So clearly people are very particular. But most of the time, then go numb the eye. Most of the time, they put you to sleep. The one day they go put you to sleep, possibly say, a major operation, we don't tell them to pull the eye, do something to them, and put them back in. But most of the time, they numb the eye, also if they're at the front, and then go there, they watch them so, and they do the operation. Yeah.
Any more questions? Because we don't run out of time slightly.
I said to ask this question. I really want let me mention them.
Okay.
If I said today in the
if for do you know
Yes.
cover the question already?
Yes, I'm here.
Yes, please. That question you asked me. Yeah.
So I want to ask the questions around people where they use wood for cook, and also they burn a lot of bush or even then dirty them. Na Sierra Leone. They not wear any protection around the eyes them. So how that go affect the eyes them? Because I remember some wood the day what be small. They so I know they go na kitchen because they burn you eye, they come down with tears as well. So I don't know whether na chemical kidena the wood or whatever. So now that I want to ask.
Well, Dr. Rashid, over to you.
Okay. Thank you, Ms. Isata, for that question. I think this is important because plenty women they cook with firewood, even free tongue, while the last time I've been there, especially then cookery woman them. And so that makes this question very important. I will try for answer and then Dr. Kamara will come in. Wood smoke can cause a range of problems there, when are immediate or long-term effects them na the eye. Mainly because of two classes of reasons. Number one, we get what they call fine particulate matter 2.5, now the name dandy, and then toxic gases. So this firewood, where then they burn in the course of cooking, they produce gas, we get chemicals them. Some of them chemicals here na acrolein, formaldehyde, polycyclic aromatic compounds, even nitrogen dioxide or carbon monoxide, and plenty others them. That why they cause irritation, immediate irritation at the eye. And that irritation, they lead to inflammation, where they call conjunctivitis in the eye. So those are some of the immediate problem there where that firewood smoke they cause. And the symptoms to these causes, one of them, the eye, they become red. Sometimes themselves, it sounds like they cry when they peel yabas. Now that kind of sensation then they, because of these chemicals. And it also, they give dryness or gritty eye. The feeling where you get if you get Apollo, where if you say the pack sansa na the eye, or what we call foreign body, the eye can pull water, you're not able to see clearly, and then the surface of the cornea itself can become damaged. For the long-term problems, then, this smoke from firewood, because of them chemicals here, can cause cataract as well. It can also cause conjunctival disorders. It can also cause disorders now, other parts of the eye, like the sclera, the cornea, the iris, etc. What they call dry eye syndrome or dry eye disease is also part of it. Now, the long run. How this they happen? Well, as I've been saying earlier, the fine particulate matter when this PM 2.5 inside the wood, it can deposit na the eye in surface, then chemicals here, where they trigger inflammation. This inflammation, they release what we are called pro-inflammatory mediators like interleukin 1 beta. This, they make the eye, they tear, tears, then they fall from the eye, and the inflammation, they progress, and they kind of unblock the delicate balance where they between the tear film na the eye, where that tear, that water, they evaporate quick, so much so that the dryness na the eye, they result. This na the way where then chemicals here, they cause problem na the eye. So I don't know if I try for answer the question, but yeah.
Yeah, I think you don't give the best answer where you could give because of the goodness and thingy, the tightness of time. One let we try for round up for today. Asita, you get the answer where you want, correct? Or Dr. Kamara, you can round them up when you do your round up. Okay.
Yeah, yes, I get a better understanding of what's in the happen. And not be no saying so they get dangerous chemicals and they would like formaldehyde, and things like that. But yeah, thank you very much.
Thank you so much,
Asita. Yeah.
Galaxy not come back again, so I'm not going to go back to him. So if I'm doing plenty, thank you. We can round up for today.
No round up it. No round up it.
TJ.
Yes.
I don't know. I think it's fine for allow Dr. Kamara for Rob.
And that is just so it will round up where they doing in final stock. Because we get for round up because we don't make a promise and now we don't go 15 minutes over, and that is not good. I know CS. We get for good people the information, but also we get for stick to time. Whereas once people don't give it in time, we don't make a promise. We get for make sure so we stick to that. Okay. Dr. Bell, you want to give family your last word, please?
Yeah, me family on a good evening. First of all, we thank on all who join in for this conversation. It's a very important topic as well. We tell Dr. Thank you for we present and so we and we hope say on all listen and we know say me can't left this place also without talking about me Bella woman we know say also where woman then gets Bella then they also can get changes in the eye. Especially the one that with the glasses, they can find out, say, oh, the eye, it's tend for one to get for change the glasses, for instance. Mostly because of the hormone changes that they can happen. They can get them, they can get puffy eyelids them as well. Their eye they can dry as well. So woman can get some really blurry visions then, but the two main important things we for talk about now the pre-eclampsia. Woman can get pre-eclampsia, and through the pre-eclampsia back, it can also affect the eye. And also women then with pregnant, some of them can also get diabetes. And then the doctor don't talk extensively about that as well. So that means the women that will get diabetes, pregnant women that with diabetes in the pregnancy, they can be affected get problem with the eye as well. So I make always also recommend pregnant women then for make them go to eye doctor for make them at least go 110 for make them go check them, or if they find out say something wrong with their eye, let them go to doctor for make them check them. Once again, thank you, and we all know say well Bɔdi Bεtεh passion team.
Thank you so much, Dr. Bell. Isata? If you talk away, you're on mute, I define you.
Sorry. Good evening, everybody. Firstly, I want to thank Dr. Conteh very much for such informative and educative talk about the eye. And the first one we don't ever listen to. So it'd be very good. So the general advice I'm not going to repeat everything, is look after your health, eat properly, do eye checks them. Now, England, we get some health checks that they do. I think say from around 40 or 45 years, they go begin invite you for do general health checks. So the one where they ask about diabetes, I think say then they came for see pre-diabetes and pick them down they up, they begin follow you up. And I sure say a lot of companies now in Sierra Leone, they can check the day. So that time they can able pick up if you get potential for make you get diabetes in the future way, of course, itself will lead to the diabetes, diabetic retinopathy, eye blindness. But yes, now that's how all that I therefore say. Well, thank you for joining us. Well, Bɔdi Bεtεh pass Gentri. Thank you.
Thank you so much, Isata. Dr. Kama?
Yes, Pamela, and thank you when I join me. And this thing, this blind eye business what they talk about, I don't think some people appreciate the importance of them. So man, they wait till late before they come for country for such amount. We make I talk that now because the eye now the key to the world. So anybody, the person where they see, you don't need for tell them waiting they happen to them. Because believe you me, all the other sense they get for grow, for let you live at least a normal life. That just tells you how important the eye is. The reason for this is that the eye they get affected by different things in them. We don't talk about diabetes. We don't talk about glaucoma. We don't talk about blood pressure. We don't talk about trauma. Even when they grow older, it affect the eye. Let you see no more. So if you miss it because you're young, nothing will go and bug you well. See the number of people with these glasses with them so 10. Look with doctor, don't tell you about belly woman them. Different things. So it's important for me to know about the eye and get them checked regularly. Somebody will get glaucoma in their family at the age of 40, supposed to get checked. Every 6 months to a year. Me say somebody saying so last Monday night and go check my eye for me blood pressure, me pressure na my eye. And thank God it did less than 20. It just goes for sure now. Because if you wait till late when like that, by the time Mara, well, you don't get problem. So we want to avoid that. But the only way we could do that now when we hear it, then can't talk here. So if you benefit from this talk, pass the message on to other people. Let them join me. Let them can enjoy and can get benefit because if you save one life, it's people like you save the whole of humanity's lives, as it were. And if you take one life away, it's like when you take the lives of all of humanity. But as you know, if you get well Bɔdi, you don't gently pass anybody in this world. So I thank you now, and God bless you now.
Thank you very much, Dr. Kamara. Auntie Nafi, you could be next after Dr. Ture. Dr. Ture?
Hello, yeah, you hear me?
Yes, sir.
Okay, Famulona, thank you for joining me today. We really appreciate you can join me. Dr. Kamara, thank you so much. You know, you make a very difficult topic simple, you know, for let you unravel all in things a day within just a few minutes to an hour. That's really good, you know. You get a whole specialty they deal with that. I mean, I'm not going to repeat what people they don't say. Yeah, so don't talk enough about diabetes. We don't talk about the health checks. I don't talk, say, anybody get anything a day, you get for the go let them go check your eye, you know, more for diabetes. We don't talk about cancer. Say you need for the go regularly, let them check you. Talk about prostate cancer. We know say PSA not reliable, but at least if you're not from Caribbean, you get for go let them go check you. For excluding thing a day. So the more you go for let them do the health checks, the better it is. And the boss you ask for the pterygium, but wear glasses sometimes no be saying a bluff or protect yourself from bad things and you know, like how Dr. Kamara don't talk, you know. So yeah, especially the sun salon and everything. So for the wear glasses go better, protect them things and you see. So preventive medicine is far better than, you know, all them curative and all them fancy things they do. If you go get even simple operation, yeah, that skin there, if you heal yourself with fibrosis, you know, feel like the normal skin. So you prevent yourself better than anything. So which is why we're doing these sessions for let you prevent things happening to you, let you go live a far normal, healthy life. You know, you see this, I see patient now with the 90, 80 years, you understand? You go ask, say, this one at this age, you old. But we own community, we don't reach 50, it's like say, don't reach the end mark, you know? So we can do much more if only we work with these kind of sessions, we listen, we follow, and we not only wait things wrong before we go see doctor. So now for share them things there, it will make people live in the 90s and 100s, you know, in a salon, if only we able for, not miss everything and money no more, you know? So now this no more. Hope so now we join with the next sessions as well. I tell you now all thank you for your journey. Thanks now all so much. Thank you.
Thank you so much, Dr. Ture. Auntie Nafi?
Yes, good evening, everybody. First of all, I want to tell Dr. Rashid, thank you for the presentation, great presentation. We don't learn a lot. Some of them are refresher for me, some of them are new things for me. In terms of the advice, Dr. Ture and I think they don't say already. Me, I always believe in prevention, like what Dr. Ture say. The best thing for doing is for prevent things that will happen. If they do screening, like we to move in the ask you know, earlier on, screening very important. Like my other colleagues and already mentioned, at 40 years, then they screen. Sometimes they even screen, you know, before 40 years, depending on the family history and also the ethnicity and risk factors. So do your screening. If you don't know, say if you have diabetes, you then at this call, you know, say diabetes now one condition where they affect people in the eye. Go screen. Even if your family, not a family history of diabetes, go screen, check your eye regularly. Not wait till you sick before you go to hospital. Because in some communities, especially in our own country, some are not the only then you go hospital pass away sick. It prefer for spend money where you don't sick rather than for screen and for make sure say you prevent something. So do you not forget when I not say, well, Bɔdi better pass Gentri. The better for you for like prevent the sick than you get for deal with the treatment. Thank you.
Thank you so much, Auntie Nafi, and thank you everybody who joined. Thank you very much to Dr. Rashid. The topic there certainly keep big guy, but to not try for make camp for like be interactive way. I believe people don't learn a lot. And like we Auntie Nafi say, and how the other doctors don't talk to today as well say, let we try for spend money before the problem come. And they say, no, go watch that video and all the Tiwa Savage and all that kind of stuff there. Yes, we spend a lot of money in December for watching anything, and the boss don't remember say health is wealth. For me, the takeaway question I go ask, now rhetorical question, I look for answer now. So how accessible, you know, we get then centers there for do testing. How regular, you know, then testing they get done. Maybe Bella Woman place or maybe na schools them, and also the rural areas, for example, at the country. You know, how accessible we able to do it, how regular they do the testing there. Not to any point I'm saying so Papa government, but they also look and say some of we now, so maybe we will get the access there for we're able to help people them. So I go say take a leaf out of your own book we will try for do the best we can. By God power, one day we say we will get an opportunity for we try for begin offer the kind of service there. Who knows? But till we meet again, well, Bɔdi.
No go yet, no go yet.
Yes,
no
sir.
go yet.
Yes.
Ladies and gentlemen, we shall be seeing the internet or not? We not shall be seeing we will get 3 birthday people them. And they announced on all.
Another date until next week. We found them on a plenty, thank you. Till we meet again with Bεtεh Gentri. The next session will be health and faith. So I will say because the first month they come for both Christians and Muslim. So we'll do health and faith where we're going to look at the benefit of fasting from a health standpoint, but also from a religious standpoint. When I forget what about then.